Today we're bringing together all the stakeholders across New South Wales and from across Australia to talk about how we use data in cancer care. The title of this conference is Flipping the Record. What we mean by that is we want to transform the way we capture and use data. At the moment, data is largely captured by electronic medical record systems. It is not really turned around and provided back to the clinicians to change the way that they deliver care. They can't access it easily, they can't ask questions about the care they deliver or the outcomes of the care that they deliver.
We need to work with clinicians to understand large data sets, their strengths, their weaknesses, the opportunities and their limitations.
Because we have enough data already, we don't need new data. We've got mountains of it, and what we need to do is better use the data that we already have.
The barriers to good data implementation, I think, are largely related to silos of data and needing to connect different data systems that talk differently to each other.
Record systems are getting better, but until we get it as a tool like a stethoscope for our frontline physicians and nurses, we'll never get real-time data going into our research databases.
Some of the other barriers come from, for example, government regulations and very reasonable efforts to protect the privacy of the data, so that ethics application and access to data can take months or years.
Currently, a person with cancer does not have access to their records, and that's a barrier to understanding their treatment and understanding what is happening with them and how their treatment is progressing.
If I can change one thing in the system, I'd like to see less bureaucracy.
Reduce regulation, keep security and privacy intact, train clinicians up in data skills.
The future for me is when we actually no longer talk about data, but we talk about knowledge and information and how we can use that to transform care.
Personalised data. Why don't we push that information back to people in the same way that Google feeds us information when we log on and search for something?
I'd like to be able to open a digital file at the click of a button, within seconds, access the data I need immediately to make decisions and have informed conversation with my patients then and there.
The best thing about today's conference is the enthusiasm of all the participants and stakeholders.
It's going to be transformational.
Completely innovative.
Fascinating.
One word to describe today's conference for me is exciting.